ask the question of the 5-minute rounds. They are from now on.
I've been there, Senator.
Thanks, Mr. Chairman. Mr. Secretary, as you may recall, Congress provided an additional $6 billion, with a B, $6 billion in fiscal year 2025 for the VA to meet the higher than expected costs and demand for VA health care. That funding was supposed to be spent on additional providers, community care utilization, rising costs for prescriptions, and prosthetic devices. My understanding is that almost all of that $6 billion was used to cover the cost of the cuts in staff, deferred resignation program, and voluntary early retirement that included paying out vacation time to employees who were paid to stay home and not work. Can you provide this committee with a full accounting of the $6 billion, which I think is very important because apparently it was used to push out essential VA healthcare providers rather than sustaining VA medical operation as we intended? I know you may not be able to do it right here, but I would like an accounting of that $6 billion, hopefully within the next week.
Mr. Ranking Member, sure that we'll look at it and get through the numbers of that. Richard Topping, my OM, is here, and we'll get you that information. But I will rest assured, one of the part that I would just take a little bit of umbrage is nothing was used to push anyone out in that regard. These are all
well, rather than going
issues,
into the rhetoric, I want the numbers.
You get the numbers.
And talking about numbers, my understanding is that more than 40,000 employees have left the VA since last January. Can you provide this committee with a detailed, updated workforce compilation of data, the number of staff who've left the VA since January 2025, broken down by facility and position, and the list of positions and vacancies each facility plans to cut based on the caps that you set late last year?
Mr. Ranking Member, number one, there's no, we'll deal with the caps issue in probably best. That's why Mark Engelbaum is here from Human Resources, who'll be happy to answer that question.
Well,
we'll get you information. That's not a problem. I want to make sure I get you from me. Yes, we'll get you the information. But I think it's good not only for this public to hear, but also for you to hear what it is actually the numbers from HR on this.
You have numbers, sir?
Yes, Senator, and we'll provide you the numbers and position level detail. For clarification, we reduced about 30,000 personnel, not 40,000. The 40,000 is the total losses, sir. We actually
the total losses. I understand that you've hired people since then, but not necessarily for the same positions. That's why I want the breakdown. We've asked for it repeatedly, sir. We have not received it. I'm asking again in this forum. I shouldn't have to do so, but I welcome your willingness to provide this information. Let me ask you next, because my time is limited to 5 minutes, the department's annual veteran suicide data report is overdue, even though it has reportedly been complete since September. Can you confirm your legislative affairs team has issued a non-concur to the report when it was provided by the VA Office of Mental Health and Suicide Prevention?
Mr. Ranking Member, I have no knowledge of a non-concur. I know that the report was being finalized in the fall, and then the
well, it's overdue. Will you provide it?
Yeah, we're providing, and it hopefully will be out very soon.
As you no doubt agree, veteran suicide is a major issue, tragically and unfortunately continuing as a major issue. Do you
There's
agree?
nobody in this room more apparent than that, and nobody working harder to make sure
I
that
think
that
you
happens.
owe it to the Congress and to our veterans that report is issued.
It will.
Let me just say, on the issue of mental health, wait times have increased. Can you provide to this committee the wait times for mental health care in facilities across the country. I'm asking for the details in regard to those whatever number of facilities there are that provide mental health care.
I'd be happy to. In fact, I can give you some numbers now, but also something that I could not give you when I first appeared for my confirmation hearing was a dashboard that actually looked at metrics such as that I could see every facility on a real-time basis.
Well, then you can see that the wait times have increased
and well,
sometimes to 50, 60, or 70 days.
Actually, that's not true. And as of January 21st, the national average for mental health care for new patients is 18.8 days. The national average for established patients is 5.8 days. And if you need an emergency care or you're in need of or you're in a crisis situation, you have immediate care. That is the actual numbers.
Well, that is contrary to the information we've been provided, and I'd like facility by facility data on the wait time for mental health care. My information is 1/3 of the states have an average wait time exceeding 40 days. Only 3 states represented on this committee have new patient primary care wait times below the threshold for community care, and the wait time for mental health care at many VA facilities is 50, 60, or 70 days. But I welcome the information that you are going to provide. Mr. Chairman, I apologize, I'm over time.
I didn't notice.